So in South Africa, we have a number of stigmas and myths that transpire. One of it is particularly linked to the state of the healthcare system, where people feel that being diagnosed with cancer is a death sentence and that there's no treatment, or that the treatment is worse than the actual disease just because of the nature and the modality of the treatment. There's also a lot of literacy issues, health literacy issues, when it comes to even understanding that in languages there aren't in some of the African languages there aren't even words for things like radiation and radiotherapy and radiology. So that's something that we have to come. Then we have cultural myths and stigmas where women that have lost part of their body are seen as less, or that they won't be accepted into heaven or accepted by their ancestors. There's also the myth that your cancer is because of a curse. There is the misunderstanding and the myth that only white people get cancer or only black people get cancer, depending which culture you're in. So there are a number of those ingrained societal myths that we're looking at, and we're using and creating patient stories as well as education campaigns to educate people, but not only dealing with the public and the patients, but also looking at the cultural leaders and the traditional leaders that speak to those and have the ears of their communities and their constituencies.